Hey everyone, welcome to the MediByte channel. I'm so glad you're joining us for today's explainer. As a healthcare professional from MediByte, my absolute goal is to break down complex medical topics into clear, bite-sized insights that you can actually use. Today, we're zeroing in on a totally critical pregnancy complication that every expecting parent absolutely needs to know about: preeclampsia and eclampsia. We're going to demystify what these conditions are, exactly how to spot them, and what happens when you go to the doctor. Okay, let's dive right in.
So if we look at the global data, preeclampsia pops up in about 5% of all deliveries. Now, 5% might sound like a pretty small slice of the pie, right? But think about it. When you consider the millions of babies born every single year, that 5% translates to a massive number of expecting families. Grasping this information is just so vital. Why? Because knowing what to look out for really empowers you to act quickly, and that ensures a safer pregnancy for both mom and baby.
Here is our quick roadmap for today. We're going to cover 1. Defining preeclampsia and eclampsia, 2. Identifying the risk factors, 3. Spotting the warning signs, 4. Diagnosing the condition, 5. Treatment and safe delivery, and finally, 6. Care after delivery. Let's get to it.
Section 1. Defining preeclampsia and eclampsia. What exactly are we talking about here?
Medical terminology can be pretty intimidating, but it really doesn't have to be. So what is preeclampsia? Simply put, it's a very specific combination of symptoms. It involves either brand new high blood pressure or a sudden worsening of existing high blood pressure that pops up after the 20th week of pregnancy. But listen, high blood pressure alone isn't the whole story. To officially be classified as preeclampsia, that high blood pressure has to be accompanied by excess protein in your urine. Medically, we call that proteinuria. It's this exact pairing, the blood pressure plus the protein, showing up in the second half of pregnancy that really sets off alarm bells for doctors.
You can kind of think of preeclampsia as the warning bell, the precursor. Eclampsia, on the other hand, is the severe, life-threatening progression of the whole thing. Eclampsia happens when a woman with preeclampsia suddenly starts having unexplained seizures. And honestly, if it's not treated right away, eclampsia can literally be fatal. That is exactly why catching and monitoring those early stages of preeclampsia is absolutely 100% essential.
All right, moving on to Section 2, identifying the risk factors. We know what the condition is. Now let's talk about who's most likely to get it.
So the crazy thing is, the exact underlying cause of preeclampsia is actually still a bit of a mystery to medical science, but we do have a really clear picture of who is at a higher risk. For instance, you're more likely to develop it if this is your very first pregnancy, or if you're over 35 years old. Carrying twins or triplets, that definitely increases the physical demand on your body and bumps up the risk too. Existing health stuff plays a massive role as well. Things like having high blood pressure or diabetes even before you got pregnant, or dealing with obesity. And you know, genetics and background absolutely matter here. A family history of preeclampsia, as well as having non-Hispanic Black, American Indian, or Alaskan Native ancestry are all well-documented risk factors.
Section 3. Spotting the warning signs. We know the risks, so let's shift over to what you physically might feel.
Now you might be sitting there wondering, okay, but what exactly should I be looking out for? What are the red flags that mean I need to drop everything and get medical help? Well, here's the tricky part. Some women don't feel any noticeable symptoms at all at first. That's exactly why those routine prenatal checkups are a total lifesaver. But for others, the body sends out some very loud distress signals.
I really want to pause on this specific quote straight from our medical sources, because honestly, this is potentially life-saving advice. Call your doctor if you have sudden swelling of the hands or face. Look, a little bit of puffiness in your feet, totally normal during pregnancy. But sudden, super noticeable swelling, especially if your ring suddenly won't fit on your fingers or your face looks puffy, that is a huge red flag that your body is abnormally holding onto fluids.
Let's dig into the rest of those severe warning signs, because preeclampsia can escalate quickly and actually damage organs like your brain, your kidneys, and your liver. Alongside that sudden swelling, which is called edema, you might see crazy quick weight gain. We're talking sometimes more than 5 pounds in a single week. You also need to be hypervigilant for severe headaches that just won't go away even if you take standard acetaminophen. Other major indicators: blurry or distorted vision, a really sharp pain in your upper right abdomen, which is right over your liver, by the way, and difficulty breathing. Seriously, if you experience any of these, do not wait around. Call your doctor immediately.
Section 4, diagnosing the condition. Let's pull back the curtain on what actually happens at the clinic.
A doctor's evaluation for this is incredibly systematic, and honestly, breaking it down into these 3 simple steps takes a lot of the scary mystery out of it. Step 1, Just a basic blood pressure measurement to check for those elevated numbers. Step 2 involves urine and blood tests. They're hunting for that excess protein in the urine, and the blood tests check for any sneaky signs of organ damage in the mom. Finally, step 3 is all about the baby. They'll do fetal monitoring to check the little one's heart rate, and an ultrasound to look at amniotic fluid levels, fetal size, and how much they're moving. It's just a really comprehensive look at both of you.
Section 5. Treatment and safe delivery. Let's look at how healthcare professionals actually manage and treat this once a diagnosis is made.
So ultimately, the safe delivery of the baby is the best, and really the only true cure for preeclampsia. But doctors have to do this incredibly delicate balancing act, weighing how severe the condition is against the risks of delivering a baby too early. If you're under 34 weeks pregnant, they prefer to do very close monitoring, usually right there in the hospital. They might even give you corticosteroids to help the baby's lungs mature faster, just in case an early delivery becomes necessary. Now, between 34 and 37 weeks, if the preeclampsia gets severe or eclampsia actually hits, delivering the baby becomes the top priority. And if you've already made it to 37 weeks or beyond, the standard game plan is usually just to induce labor and safely deliver the baby.
I do want to highlight one specific medical intervention here because it's a total game changer used in hospitals for those severe cases. If a mother has severe preeclampsia or it progresses to eclampsia, doctors will give her intravenous magnesium sulfate. This is a vital medication used specifically to prevent or stop those seizures from happening. It essentially protects the mother's brain and body while the medical team prepares for the absolute safest delivery method possible.
Section 6. Care after delivery. This is the final stage of the journey, and honestly, it's way too often overlooked.
Okay, get this. Most people just assume that the second the baby is born, all those scary pregnancy complications instantly vanish. But did you know that preeclampsia and eclampsia can actually develop after delivery? It's true. It mostly happens within the first 4 days, but it can literally show up to 6 full weeks postpartum. It's kind of a wild fact, but knowing it is so crucial. It means moms have to stay super vigilant about their own health, even while navigating the beautiful, exhausting chaos of having a newborn at home.
Because of that sneaky postpartum risk, medical care absolutely does not stop at the delivery room doors. Your blood pressure needs to be monitored really closely for at least 1 to 2 weeks after giving birth. Then, at 6 weeks, a follow-up is standard just to make sure you haven't developed chronic hypertension that might need ongoing management. And hey, here is a really fantastic proactive strategy. If you have had preeclampsia in the past, taking a daily low-dose baby aspirin starting in the first trimester of any future pregnancies can actually significantly reduce the risk of it ever happening again.
And that brings us to the end of our explainer today. So are you ready for a safe and informed pregnancy? Understanding conditions like preeclampsia and eclampsia isn't about scaring you or adding stress. It's completely about arming yourself with the knowledge to protect yourself and your baby. When you know the signs and you trust the science, you can navigate your pregnancy with so much more confidence. But it does leave you wondering, right? With all these advancements in prenatal care, could simple interventions like taking the daily baby aspirin eventually make preeclampsia a thing of the past entirely? Anyway, thank you so much for joining me today. If you found this explainer helpful, please hit that like button, share it with any expecting families who could really use this knowledge, and don't forget to subscribe to the MediByte channel for more clear, structured health explainers. Stay healthy, stay informed, and I'll catch you in the next one.